Okay, receptive enough. We'll go on to eruption and shedding. There are a few more, few points which are important here, and there's few detailing out which, as I move on, I'll probably concise it up. So, okay, it shouldn't be taking that long. Okay, so when we talk about the eruption is a process of teeth, starting from its starting position when it reaches the occlusion, that is the eruption process. Okay, now there are three movements. One is a pre-eruptive movement. Pre-eruptive movement means when the crypts are inside the bone. Okay, when they have not yet reached the epithelium, they have not yet come into the oral cavity. That is the pre-eruptive movement. Eruption, they are not started moving over here. Eruptive movement is when they come here till they reach the occlusal surface. Okay, that is the eruptive movement. And post-eruptive movement is after they reach the occlusal surface, still the tooth continue to move. That is the post-eruptive movement. Okay, so pre-eruptive movement are the movements which are made by the deciduous and permanent tooth germs before they begin to erupt. Okay, so they are not erupting, they are just moving inside. Why they are moving inside? There are some reasons for that. One is they are moving to get themselves adjusted in the growing jaw. So jaw is growing and there is a lot of space in the jaw that is being created and all that. So based on that, these crypts, they adjust themselves. That is a bodily movement of the crypt in the growing jaw. So understand, there is one bodily movement. Okay. Second thing is eccentric movement. See the term. When we say eccentric movement what happens is your tooth germ is actually growing, isn't it? When the tooth germ is growing, sometimes it grows, it doesn't grow totally, in all direction. That tooth germ is taking different shape and it grows, more in one side, less in other side and all that. Based on that, it will bring about some changes in the surrounding crypts. Okay. And in that particular changes, the center of the body of the thing changes. So when bodily movement is happening, the whole crypt is moving. But when eccentric movement is happening, one part of the crypt is growing, one part is stationary. Understand the difference between the two things? These are the two types of eruptive movement happening. Are you all getting me? You want me to explain that? Okay. Yeah. Now, whenever these crypts, so that was a pre-eruptive movement. Now, there's one more thing about the pre-eruptive and eruptive phases is the position of the permanent tooth bud with relation to the deciduous. It changes. Initially, when we talk about the permanent tooth bud is positioned exactly lingual to the deciduous. But when we come to the eruptive phase, the permanent tooth bud is positioned lingually and apically. You can say it becomes apicolingual in position. Okay, and this depends on the phases. Pre-eruptive phase and eruptive phases, it is different. And there has been an MCQ on this particular point, so be careful on this particular thing. Okay, now look at these position. When we talk about the pre-eruptive phases, even the something that is below the premolar, permanent premolars, they are positioned lingual to deciduous molars. But as we come to the eruptive phases, the permanent premolar comes below the deciduous molars. Right? So this is the position changes that happen in pre-eruptive and eruptive phases. Now when we talk about the eruptive tooth movement is when the tooth starts moving from its position within the jaw, okay, in the occlusal direction. So basically what this phase is doing is it's making the tooth come to the occlusal side, and it is divided into two phases. One is the intraosseous and the second is the extraosseous. So you can say when the tooth bud or tooth, it moves from here till here, it is the intraosseous eruptive movement. When it breaches the cavity and starts moving till the occlusal surface, it is the extraosseous movement. Okay, so these are the two movements in the eruption. Now when we talk about the histological changes that are taking place in this eruptive phase, okay, there is PDL remodeling taking place. Okay, now PDL remodeling whenever taking place, whenever we talk about the remodeling part, what does it mean by remodeling? Remodeling means there is resorption and there is deposition taking place. Which are the cells responsible for degradation and formation in PDL? Can you all tell me the cells which are responsible for degradation and formation? No, we are talking about the PDL degradation. Be very careful on this particular thing. We are talking about PDL remodeling. Yes, it's the fibroblast. Now one very important thing about the fibroblast is they have the formative function also and they have the resorptive function also. So fibroblasts, they can resorb, they can form. They are amazing cells. Okay. Now what happens is whenever there is eruption taking place, now the tooth itself, now you all must have been seeing in the last class that our enamel organ, it gets condensed and it forms reduced enamel epithelium. This reduced enamel epithelium which covers the tooth. Okay. Now this reduced enamel epithelium has a kind of condensation that develops here. Okay, this condensation is called as fibrocellular follicle. It's fibrocellular. It has the cells and fibers getting condensed around the erupting tooth. Okay, now when this particular tooth is erupting, the path of eruption is kind of, it becomes a condensation of cells, and this condensation of cells is called as gubernacular cord. Let me just go on to the whiteboard and give you a better diagram. I have a diagram, one second. Yeah, look at this particular thing. You see, this is the follicle, basically the crypt surrounding the tooth. Okay, now when actually surrounding it, what happens, there is a lot of connective tissue. Okay, but just above it, in the path of eruption, what happens, there is condensation of the cells and condensation of the connective tissue. This condensation results in formation of gubernacular cord. Okay, through this gubernacular cord, it provides a pathway of eruption for teeth. Yes, it guides the teeth to go. Now there is one more thing. When we talk about the permanent and the deciduous, see, this is deciduous and this is permanent. They both are in their own bony crypts. There is something that connects between these two. Again, when we talk about the cellular structure, the epithelium condensation, it is called as gubernacular cord. But when we talk what is something, that space which is present in the bone, that canal is called as gubernacular canal. You understand the difference between the two? The cellular structure which is packing up that bony canal is the gubernacular cord, but that bony canal that joins the permanent and the deciduous tooth is your gubernacular canal. Okay, so this is your gubernacular canal. Whenever the tooth has to erupt, now this gubernacular canal is not only present between the deciduous and permanent, it is also present above the deciduous till the oral cavity, wherever the tooth has to go. Okay. So whenever it has to erupt, for example, deciduous has to erupt, there will be widening of this particular canal. If permanent has to erupt, there will be widening of this particular canal. When permanent erupt, it goes and resorbs the deciduous and then it erupts, isn't it? So that's how the gubernacular canal acts as a guiding path for the tooth to erupt. Now there is, we had been talking about two phases of eruption. One is the intraosseous and second is the extraosseous. Intraosseous, wherein all this resorption will take place, the gubernacular canal will be widened and then the tooth will erupt. That is the intraosseous. When we talk about the movement in the intraosseous, it's 1 to 10 millimeter per day. Micrometer, sorry. That is the rate of eruption in intraosseous. But as soon as the tooth comes onto the surface, the resistance is gone. The bone is not there. Now it goes very fast. It is 75 micrometers per day once it comes out of the bony cavity. Get the point? Yeah. Now there are some other forces as well, like muscular forces, which like forces from the tongue, teeth and all those things, tongue and cheeks and all that will affect the movement of the tooth, and these forces are in the range of 4 to 5 grams. 4 to 5 grams. Right? Even such small forces are capable of moving the tooth, and we have the best example of thumb sucking. You can say how much that affects the position of the tooth. Now what brings about the eruption? We saw the path of the eruption, but what will bring about the eruption? What tells the tooth that it has to erupt? There are various theories for that. One theory is root elongation theory. Authors say that root elongates and it pushes the tooth out. But there is no particular evidence saying that, tooth needs a root to be formed. Even the teeth with smallest root, they erupt at a proper time, and sometimes teeth with the longest root may get impacted and they lack the eruptive forces. So it is not about the root elongation that is necessary for the eruption. So this theory is kind of getting void. So let's move on to the next thing. Next thing is alveolar bone remodeling. This alveolar bone remodeling says that, when the tooth is there is bone deposition that is taking place here at the lower side of the tooth, and because of the bone deposition, tooth is pushed upward. Again, this theory is not proved. It is just a theory, and there is no proof, because they found that some places there is bone deposition, but there are many other places there is bone resorption. But teeth anyways erupt. Okay, so even this theory was not satisfied. Then there is a theory of dental follicles role. Okay, it says that this particular tooth, okay, which is surrounded by the dental follicle, this dental follicle has some signals that causes resorption of the connective tissue, and lets the tooth erupt. Now from where does this particular follicle get the signal? And why does it only go in one direction? Why doesn't it go in downwards direction? Because condensation can be present throughout the teeth, right? Now why teeth has to go upward? Why it doesn't go downwards? Now they give an explanation that this signal is coming from the stellate reticulum. Do you all remember the stellate reticulum? Stellate reticulum were present in the crown portion. They were not present in the root portion. Okay, they say that these signals are coming from the stellate reticulum. So this stellate reticulum gives the biologic clock. It provides a biologic clock, some signals that tells the tooth when to erupt. Okay, now this statement is important. This could be a probable source of MCQ, that biologic clock is provided by stellate reticulum that gives the timing of eruption to a tooth. There's one more point that you need to know, that the reduced enamel epithelium that is surrounding the crown, it produces proteases. It produces proteases which can degrade the connective tissue and help the tooth to erupt. Okay, although we do not have many solid proofs to this theory as well, but this seems to be, yes, Saurabh, very good point, you know. They say that yes, but stellate reticulum is so much collapsed. How come stellate reticulum has the signal? Then there are some authors, they argue that stellate reticulum passes the information to the dental follicle which is around the crown. That is why crown retains. This is all about signals, you know. After lot of studies, it was found that eruption is genetically mediated. Environmental factors do not much affect eruption. Okay, and eruption is the most, you can say, a mysterious phenomenon in the teeth development. They don't know why it's erupting in one direction, why this erupts then, and you know, all these biologic things. So these are the suggested or proposed theories about it. Okay, and the argument which you have put, yes, the whomsoever authors do not support this theory, they put in that argument that yes, stellate reticulum is already collapsed, isn't it? But till now, that is the only thing, you know, people have proposed, that stellate reticulum may be a probable source of biologic clock signal. Yeah, periodontal traction theory also we'll talk about. Now, when we are talking about the molecular signals, you know, there are many molecular signals which are associated with the eruption of the tooth, and in these molecular signals, the main ones which you have to remember, which could be possible source of MCQs, is BMP2, the bone morphogenetic 2. If you look at the other things, the growth factors are obvious, colony stimulating factors, you know, and all that, nuclear factor, transforming growth factor, parathyroid, all these are growth factors. So we all very well can guess that they'll be associated with tooth eruption. But BMP is, you know, bone morphogenetic protein, in that typically 2 is associated with eruption. This is an important point. Okay, and there is this one, runt related transcription factor 2, RUNX 2. This has been asked in MCQ. Okay, this is associated signal with tooth eruption. I'm so sorry about it, but they do give such question. The table is from Every, and we do expect questions from here. Okay? Are you able to recollect at least few of them? Okay, I had the post-eruptive movement. Yeah. Regarding, Saurabh, you know, regarding that periodontal traction theory, the basic concept behind periodontal traction theory is, you know, having those fibroblasts creating the contractile forces pushing up the thing. But the main thing is, even before the periodontium starts developing, your tooth starts moving. So periodontal development is kind of a synchronous process along with the eruption of the tooth. So that is the reason why the sole eruption cannot be attributed to the traction from the periodontium. Yeah, probably it could be the most accepted. So I'll just look into that. Did you check into Orbans? Actually, my slide today is most from 10K and Every. I'll just look into Orbans, maybe it's there, this thing could be most accepted. When we talk about here in 10K, they give a statement wherein they mention 3 theories and then they say most accepted. In that you have the dental follicle, you have the periodontal ligament theory, they call it, and the first one they call it as bone resorption. Okay, and they just say that these are among the most studied and most argumented theory of this thing, which are the most given theory about the eruption. But the main thing ultimately they conclude is most of the eruption is attributed to genetics rather than to any other environmental factors. Okay. So as far as the MCQ point of view, if you can just come across MCQ that you find controversial, keep putting it for me on this thing. We'll just see the sentence framing and all that, and we'll work out the MCQ aspect of it. Okay. Now when we talk about the sequence of eruption, sequence is earlier in boys in primary tooth and earlier in girls in permanent tooth. Now this point is important because I never knew. If somebody asks me sequence of eruption, I'll always say, okay, girls, they have the teeth coming out early. We always have that notion, all the time. But primary teeth, it's earlier in boys. Okay, this is one point which I thought I was missing, so I thought I'll add up for you all as well. There's one very nice rule I found in James Avery. It will help you to remember some of the eruption number of teeth. Okay, they call it 6-4 rule. It's beautiful. Okay, look at this. 6-4 rule says that from birth 4 teeth will emerge for every 6 months of age. That means if a child is 6 months old, there are 4 teeth. Okay, if it's 12 months old, there are 8 teeth. Get the point? 18 months, there are 12 teeth. 24 months, there are 16 teeth. And 30 months, there are 20 teeth. So all you have to do is months divided by 6 multiplied by 4. Okay? So as simple as that. So if somebody gives you 24 months divided by 6, how much is it? 4 into 4. That is equal to 16 teeth are present in this particular child. So it will actually at least give you, a quicker way to find out the number of teeth present in a particular age child. Good one, yeah. And it's actually from the book, so it's not something made by, anyone as mnemonic or something. It's from the book. The snapshot is from Avery. Okay. And there's one more point. A tooth usually takes 1.5 to 2.5 months from the beginning. Yeah, you can write it down. It's like 6-4 rule. Every 6 months, 4 teeth are added. 6-4 rule. Okay. The tooth usually takes 1.5 to 2.5 months from the beginning of the clinical eruption to reach the occlusal plane. So once we can see the tooth in the oral cavity, it may take 1.5 to 2.5 months. Now there is one very nice point stated here. Now whenever we give a range, that this is the range, okay, it may go less than that and more than that. They say most commonly there is a delay. It very rarely happens that, teeth erupt before time. Okay, most commonly what we see is common variation that we see is a delay, not the early eruption. Done with that one? Okay, now there's one more for rules of 4 for permanent teeth. This is a little tricky. Third molars are not included. Okay. At birth, first 4 molars have started calcifying. Okay, at birth, 4 molars start calcifying. At 8 years, that is after the 4 years. At 4 years, all crowns calcify. Let us just write it down somewhere, right? Nicely, look. At birth, you can write it down with me. 4 molars calcify, start calcifying. At 4 years, all teeth start calcifying. Okay. At 8 years, all crowns are completed. At 12 years, all crowns emerge. Emerge or erupt in the oral cavity, you can say. years, all routes are completed. Written it down. So basically every 4 years something important is happening. There is an important landmark happening every 4 years. So at birth 4 molars are calcified. At 4 years all teeth calcify. At 8 years all crowns complete. At 12 years all crown erupt. At 16 years all root completed. So these are again important landmarks that could be probable. That was my thing. Don't get confused. It was simply I showed, whenever somebody gives you a month. For example, somebody asks how many teeth erupt in 18 months of, how many primary teeth are erupted in 18 months of age. What we do is 18 divided by 6, 3 into 4. Because every 6 months there are 4 teeth erupting, right? Simply you can say 18, how many 6 months are there? 6 months, 6 months and 6 months. 4 teeth and 4 teeth and 4 teeth. So it's 12. That's it. That's what I was doing mathematically. Okay? Yeah, multiples of 4. Isn't it? Now that was about the eruptive phase. Okay, now when we talk about the post-eruptive tooth movement, post-eruptive tooth movement means once the tooth has reached the occlusion, still it keeps on moving here and there. Isn't it? What are these movements? Basically they are there to compensate the growth, to compensate for the occlusal and the proximal tooth wear. Remember, teeth are grinding in mesial direction and in occlusal direction. So that is why the teeth keep moving to adjust according to those grinding. There's very nice phenomenon over here, I'll tell you. Now this post-eruptive movement, there is a fixed reference point indicated. I'll tell you. What happens is, eruption, all those continues to stop, all the teeth are erupted by 12 years of age. Remember, we saw that 12 all teeth erupt, 16 all roots completed, but eruption is completed at 12. But you remember, our jaw continues to grow till 18 to 25 years, mandible, isn't it? Now after such a wide growth of jaw, that means there is some movement taking place there. Now what is the reference point? The reference point is inferior alveolar canal. Inferior alveolar canal is considered the fixed reference point, and basically all the movement take place in relation to that inferior alveolar canal, such that the apices of the teeth, they move 2 to 3 mm away from the inferior alveolar canal. So person who is having kind of a smaller jaw, having the inferior alveolar canal a little bit in the upper position, his teeth will try to remain 2 to 3 mm away from its alveolar canal. That's what is the basic thing about this post-eruptive tooth movement. So our fixed landmark is nothing but inferior alveolar canal. It is called as the fixed reference point, and the teeth apices move 2 to 3 mm away from this particular canal. Okay, so only that point to be noted in there about that. Okay, then there is one more thing. Whenever there is continuous occlusal wear, okay, continuous occlusal wear, teeth have to continue erupting because to maintain the contact. That is simple thing. We all know that teeth erupt to maintain the contact. But what about the proximal contact? Okay, there is also proximal loss happening. Why there is proximal loss happening? Because teeth have a mesial force, mesial movement. Now why we have a mesial force? That is a big question. Okay, now let's see why we can have a mesial force. There is one very nice analogy given. It's called as billiard ball. You know billiard, that game wherein we have a long stick and a table, pool table. pool we call it, right? And we just hit that ball and we put it in the yeah. So when we talk about this game, remember, whenever there is a situation having two balls like this, okay, end to end, okay, and their common tangent, you see that, you understand the word tangent? Okay, this is a common tangent. Matlab, this particular thing is tangent to this ball and this ball, both the balls, isn't it? Now this tangent ka perpendicular is going directly into the hole. Now if we hit this second ball from anywhere, this ball will go inside this. Now this is a very important trick. This is called as billiard ball analogy. Same thing happened with teeth. Now you look at these teeth, they are like balls. Okay, they have a common tangent. Okay, now you hit this ball from anywhere, the force will be only towards this direction. That is the reason any force that is acting on the tooth is getting converted to the mesially directed force, because that mesial direction is perpendicular to the tangent that is created at the contact point. Okay, that is the reason occlusal force is getting transferred into an anterior component. Right? Yeah, isn't it an amazing thing? That's a billiard ball analogy. Okay, that is one theory given, explanation given for mesial movement of the tooth. Okay, now these authors, he must be thinking while playing billiard, and he would have applied it to to the teeth as well. Anyways, it's nice one to talk about. Then we have one more theory that says transeptal fibers are the one that is associated with mesial movement, that it is transeptal fibers which are pulling it towards that. And other than that, some people say it's the soft tissue pressure, especially the movement of the tongue and all the other forces. Whenever we are speaking also, we tend to move our cheek mesially more. I don't know. It's the concept suggested by the soft tissue pressure, and that is what is creating the mesial pressure on the teeth. So these are few of the reasons. Now, sort of now that PDL less mesially, you know what? No, yes, you can say cause and effect. Basically, PDL is less mesially because of the mesial movement of the tooth. Mesial movement of the tooth is not because of the less PDL. Now we do not know what is the cause and effect, but actually the given theoretic cause is that. Okay, you know what? Actually, when we read textbook wise, when we are reading for MCQs, we have to trust whatever they say. Okay, but if you come and do your own research, and if you write your own review of particular, you can write all these arguments. You're gonna enjoy doing that once you enter your MDS. Okay, so whenever you will be doing some research and writing an argument for that, you will enjoy doing this, contradicting the billiard ball theory and all those things. Okay, but right now we have to stick on to the facts which are given in the books. We have to consider them as facts, unfortunately. Yes. Okay, so it's just a few days more. Okay, then we move on to shedding part. Shedding mein, all you have to know is that your permanent teeth is hitting onto the deciduous teeth and it is resorbing. Remember the direction of the permanent tooth? And you would have seen, fallen teeth. They have a kind of root portion intact. Whole root doesn't resorb. Yes. Which side of the root is most commonly intact? Which side is intact? The labial side. Yes, there is a question on that particular thing. Okay, simple one. Now there are these cells which come and in the site of resorption, which are called as odontoclast. They look very similar to osteoclast. They are called as clast because they are resorbing the tooth. Now they are called as odontoclast because they are resorbing the tooth. Okay. Now they are derived from monocytes. Now this point is important. Okay, they are derived from monocytes. Even our osteoclasts were derived from monocytes. Where do they come into the resorption site? They come from the blood vessels. Okay, and they become multinucleated. They go and resorb the deciduous root. They continue resolving. Even when pulp comes in the way, they keep resolving the pulp also, isn't it? But imagine that this is a tooth. Okay, and there is resorption going on here. But amazingly, this portion of the pulp is still vital. Isn't that amazing? Whenever we talk about trauma, a little pulp exposure makes it necrosed. But look at the deciduous tooth. We have odontoclast actually eating it from the down, but the upper part pulp is still vital. Okay, and so is the odontoblast here. All the odontoblasts here are still vital. Now that's the point to appreciate here. Now one more thing that happens here is, when the resorption continues, just before shedding resorption stops. Just before shedding resorption stops, and there is a deposition of cementum-like tissue there. Okay, so this is the cementum-like tissue deposited, and there is whatever pulp tissue is there may remain intact, or if everything is resorbed, there may be some dentine that is intact or something, but there is a cementum-like tissue that is deposited just before the shedding. Okay. Now what happens to the PDL? We are talking about tooth getting resorbed. Okay, there is surrounding PDL also, isn't it? What happens to the PDL? PDL shows apoptosis. There is no much inflammation. It is just programmed cell death. So you can say shedding is also at 80% genetic. Remember, we had been talking about eruption being genetic. Even shedding is genetic. Okay, but yes, we need a permanent successor to bring about the shedding of the deciduous teeth. Many a time, because of the absence of the permanent successor, the shedding may be delayed. But it is just delayed. It doesn't mean that if the permanent tooth is not there, the shedding will not happen. Still the shedding happens. Many a times, even after missing permanent tooth, shedding happens. Okay, so yeah, when we talk about the pattern, usually it is symmetric on the both sides. The mandibular primary teeth are shed before the maxillary teeth. Usually the mandibular teeth, exfoliation occurs in girls before it does in boys. Okay. Shedding is anterior to posterior in mandible. Anterior teeth shed first, then the posterior teeth. But in maxilla, it is a canine that actually sheds the last. It is the one that disrupts the whole sequence. Okay, that's about shedding and eruption. All you have to know about shedding and eruption is those three stages. Probably you have to know a little bit about theories. You have to know the sequence, and as we move on to the dental anatomy, you will have that chronology. That is very important source of MCQs, and rather that is the most important source of MCQ. You need to know about the gubernacular cord and gubernacular canal. Okay, you need to know those few molecules, BMP2, rungs X, and all the growth factors. Okay, not many things are there, but as you do MCQ, that should be pretty easy. Okay, we were supposed to deal with that particular thing. Okay, there's an issue with the recording of the last class. In the last class, which has been taken by Dr. Shweta, part 2 has not been recorded. Now I'll probably find out what exactly was covered in part 2, and we will either put up a replacement video for that, or we can have a reclass again for that particular portion for those who have missed the class. Okay, but the part 1 was done, so that will be put up there. I think so it was an introductory DA class.